As summer temperatures continue to climb, you might find yourself seeking out cooler routes for your rides. Your horse is no different. Left free to roam, he will likely gravitate toward cooler, damper areas of the pasture, and might even wander over to find a stream or pond if he has access to one. Horses have been hardwired since the beginning to keep themselves cool. Your horse knows that hanging out near or in water will cool him off. Unfortunately, when a horse is in or around water, he is more likely to contract equine equinoxiasis, commonly known among most horse owners as Potomac horse fever. Now let's define the Potomac horse fever. It is a bacterial disease caused by the bacteria Neurichthia ristici. It's not a contiguous disease, so one horse cannot give it to another and it cannot be spread from horse to horse. In order to really get just how important good digestive health is to your horse overall wellness and performance, you need to understand the basics of how the horse's digestive system works. As we know, Potomac horse fever affects small intestine and colon. So let's talk firstly about their normal physiology, starting with the small intestine. The passage of feeds through the horse's small intestine is rapid, delivering the digesta to the cecum. In the small intestine, a majority of non-structural carbohydrate, starch, protein, and fat is digested by enzymes and absorbed. Starch is digested by amylase enzymes. Oil is digested by lipase enzymes, and protein is digested by protease enzymes. For colon and rectum, the major functions of the colon are microbial digestion of dietary fiber. Important end products of the fermentation are volatile fatty acids, which can serve as an energy source for horses fed mostly forages such as pasture or hay. Fermentation also produces methane, carbon dioxide, and water, as well as most of the B vitamins and some amino acids. Another function of the hindgut is water reabsorption. When starch is delivered to the hindgut, the starch fermenters begin to rapidly ferment the starch, producing large quantities of lactic acid and volatile fatty acids. Because of the acidic nature of these products of fermentation, the pH in the hindgut begins to fall. A low pH favors pathogenic bacteria, which can then contribute to serious diseases. We might ask what Potomac horse fever does to horses. Neurichthia ristici is an obligate intracellular gram-negative coccus that cannot be grown with conventional culture, but will grow in a cell culture. The bacteria has been identified in freshwater snails, trematodes that parasitize those snails, and a variety of aquatic insects. It is thought that horses contract the disease by accidentally eating or drinking the infected aquatic insects. Therefore, horses that live around bodies of water or in barns that use nighttime lighting, which attract these types of insects, are at increased risk of becoming infected. After the horse ingests the insect's trematode Neurichthia ristici combination, the incubation period is approximately 1 to 3 weeks. During this time, Neurichthia ristici released into the gastrointestinal tract, where it infects epithelial cells, usually of the colon. Neurichthia ristici then replicates within the cytoplasm of colonic glandular epithelial cells, mast cells and tissue and macrophages, and can gain access to the systemic circulation where it rapidly replicates within blood monocytes. The microvilli of infected epithelial cells are damaged or lost, which prevents absorption of water and electrolytes. In severe cases, mucosal compromise may also lead to ulceration and necrosis of the intestinal lining. Neurichthia ristici is shed in the horse's feces, but horses exposed to contaminated feces rarely become infected, as they would need to ingest large volumes of manure. Signs of the disease can appear 10 to 18 days after ingestion. Most cases of Potomac horse fever occur between July and September. The signs include diarrhea and toxemia, fever, colic, dehydration, laminitis, decreased intestinal sounds, Pregnant mares may be at risk for abortion, anorexia, and depression. Now, talking about how do we diagnose this disease? A provincial diagnosis of Potomac horse fever often is based on the presence of typical clinical signs and on the seasonal and geographic occurrence of the disease. A definitive diagnosis should be based on isolation or identification of Neurictia restici from the blood or feces of infected horses by cell culture or PCR. Serologic testing is of limited value as a diagnostic tool. To enhance the chances of detection of Neurictia restici, the assay should be performed both on blood and fecal samples, because the presence of the organism in blood and feces may not necessarily coincide. After we knew how bad this fever is affecting horses, we can prevent them by limiting access to freshwater streams and ponds during the summer may help reduce exposure to the organism. There have been some reports of reduced severity of clinical signs in vaccinated horses. It is recommended to try minimize the exposure to infected insects by turning off stable lights at night in high-risk areas. By coming to the end of my presentation, I hope I did it as needed, and I sincerely appreciate that I have had this opportunity to present to you. So thank you.